Oyesis Global Network is a transatlantic institution dedicated to improving healthcare services in Africa.
Welcome to Bayelsa Specialist Hospital. My name is Herbert Preye Oye, vascular surgeon, endovascular surgeon, physician in charge of this hospital. We're here in the capital of Bayelsa, Yenagoa. We have the hospital government built and being properly managed by the Oyesis Global Network. The Oyesis Global Network has its affiliates in the USA, West Virginia Vascular Institute, the Global Vascular and Wound Care Center, as well as Broward General Hospital, Appalachian Hospital. We are here because we're trying to improve the healthcare system in Nigeria and to make it competitive. In fact, we are excited at the opportunity to introduce sophisticated cardiovascular work in Bayelsa.
With the headquarters of the Oyesis Foundation, a privately managed non-governmental organization located within Bayelsa Specialist Hospital, Yenagoa, Nigeria, Oyesis Global Network has been in operation since 2012.
The Oyesis Global Network is a privately managed company that has been contracted in a PPP arrangement with the government of Bayelsa. We're fortunate to have a visionary governor here in the person of His Excellency Henry Sir Dixon, whose vision indeed is to turn Bayelsa into a medical tourism destination for most Nigerians and non-Nigerians. That's the reason why we're here. And he has graciously enabled us to come in to manage the government facility and make it more efficient.
Our focus at Bayelsa Specialist Hospital is to give healthcare at all levels to everyone who visits the hospital. We have primarily internal medicine. That says we give services for malaria, typhoid, and the basic things that happen every other day. We have a specialist center, which comprises the cardiovascular center, the stroke rehab center, a dialysis center for those with kidney issues, renal management and stuff. So basically here we have, we provide primary and secondary healthcare solutions to patients.
The importance of this center is, as West Africans now, we're developing major league disease processes that are common in Western countries, such as the USA and Europe. And we need to be able to provide that service line for our patients. It's no longer acceptable to offer patients major operative interventions when it can be done in a minimally invasive, safer method, where patients can go home the same day or next day and don't have to have large operations to have them other major complications. So that's the reason why we are looking at endovascular technology as the next best thing for the country of Africa.
The Oyesis team is led by a US-trained endovascular surgeon, and we have on our faculty a team of medical experts from the US, from the UK. So what we're going to look for outside the shores of Nigeria, we're actually bringing back here.
I'm a US-trained physician. I'm an endovascular and vascular surgeon, and I've been doing this for many years, over 2 decades. And in the rural community in West Virginia, where I reside currently, we have a tremendous amount of vascular diseases. And I was able to come into our community and introduced endovascular technology in 1997 and built several hospital programs to make them very competitive with any other major facility in the world, be it London, Tokyo, or Australia. So our goal here is to do the same for the African continent. And we've chosen Bayelsa for the specific reason. First of all, I'm a Bayelsan. I was born in Lagos, and my folks are from Bayelsa. So I have the natural instinct to come in and help the state, which is a newer state in the Federation.
We've been able to set up a cardiovascular center here in Bayelsa, state-of-the-art equipment, top-notch, well-updated, to tackle all cardiac-related issues that people may be faced with.
My goal of mandate is not only to make this hospital efficient, but also have Nigerian trained doctors and nurses be very competent and efficient, retrain and rebrand them to make sure that they can provide service no different than I would in the United States.
And the intention actually is to stem this tide of, patients going out of the country for medical tourism. We feel that everything that we need to do in terms of healthcare delivery can be done right here in Bayelsa State.
The interesting thing to note when people travel abroad for treatment is medical care is what it is. It is what it is anywhere in the world. But what makes the difference now when people decide to go abroad is because they think, okay, we'll get better care. We have access to, experts, expert rates, healthcare expert rates and stuff like that. But that's what we're trying to do as the Oyesis, bringing that here.
And I met Dr. Oye a few years ago. He introduced me to his project in Africa. With my background from Haiti and with the fact that I like to provide health and help underserved communities, I thought it was a good opportunity for me to come here in Nigeria and learn from him, not only in the US, but have a chance to learn from him in Nigeria and see how he's helping the community in Nigeria.
We are positioned to serve all categories of people we have in the society. The hospital has its general wing, which serves, the average citizens. Everyone comes in and is treated there. And then for those who are high up in the society, we also have the VIP section of the hospital. In total, it's like a 60-bed hospital, so we have that capacity to always, cater for people as they come in. But we haven't done this to put a dichotomy between patients that we have, but to say for those who feel comfortable at that level that they belong to, we have, exquisite rooms, well-furnished, available resources to cater for them, just as we have for those in the public wing as well. So bottom line, we are ready to serve every member of the society that comes in here for the healthcare need.
The reason you should come here is because we care. We care about you as a person. That's the first thing is.
Bayelsa is changing. And I'm sure if you come here 2 years from now, there's going to be more development than you see right now. So we just want to assure people that the fact that they're not Bayelsans does not say that Bayelsa is an unsafe place for them to visit. Let us take our health seriously. I mean, why would you, for instance, as a stroke patient, want to risk, flying 17 hours to, the United States, for example, when you can just come here by flight, 1 hour and get yourself fixed?
Bayelsa has what it takes in terms of facilities, equipment, manpower, and human resources for health, for the well-being of not only Bayelsans, but also Nigerians and any other person who happen to come into Bayelsa State.
If you're a physician, if you're a student, always try to reach out to Oyesis Services, and we'll find a way for you to help this organization grow and be a part of something that is moving forward, that is great, and that's very touching to lives, and that's saving lives.
The Oyesis Global Network, in collaboration with the Bayelsa Specialist Hospital, would like to tell our fellow Nigerians out there that we're here for you, and we believe in providing healthcare excellence. This is a time-tested and proven method we're bringing from the United States to Nigeria, and we have no doubt that we can help touch lives here in Nigeria.